probably 90% of the medications we prescribe. Most illnesses can be treated on some level with oral medications. So when we're seeing a symptom for the first time, or even repeated symptoms, we'll often exhaust all of our oral medications. Tips and tricks to avoid errors. One of the biggest things is to actually avoid putting meds in meals. Some dogs eat super well, eat the whole meal, pills and all. Some of them will pick around the pills, some of them will eat half of it. They eat half of it, but they eat the half that have the medications. A lot of pills will dissolve if you're giving them wet food as well. So it will really hinder your ability to know 100% whether the dog's got the meds that it needed at the time that it needed them. I would always prepare all medications beforehand. So if they're on 4 or 5 different medications, it's a slightly more complex case. You can break things down into individual bags and have that bag for the morning, have a different bag for the evening, prepare all of them together, give them all at one time. And honestly, one of the most successful ways to treat animals is to have a good routine. The more consistent you can be with when dogs get their meds, one, the better treatment they'll have, but also dogs are really receptive to structure. If you have structure to their day and they're expecting what's coming and they're getting ready for it and it's like an event, they're often much more receptive to actually doing what it is that you want to do at that time. So there's liquids versus pills. Oral meds are going to come in one of the two. Sometimes it will depend on weight. They're small animals, we'll do lower concentration liquid medications, which means you can give really tiny doses. So if you're fostering bottle babies or something like that, they're often like super tiny doses. So that would be when you switch over to liquid medications. Some medications like our dewormers just come in liquid format. So you'll be giving small volumes to small dogs, or you're giving very large volumes to big dogs. There's pros and cons to either. Liquid medications are definitely easier to give because it's just a case of squirting them in their mouth rather than trying to get them to swallow a pill if they don't want to swallow it. And kind of once it's in their mouth, there's not a whole lot they can do except consume most of it, but they're also much easier to make errors. Pills are harder to administer to difficult patients, but I mean, half a pill is half a pill. So things to look out for with liquid medications are correct dosing. A lot of that comes down to the size of the syringe. It's this tiny, tiny amount. There's a tendency, and we see it all the time, that people think, well, that can't be enough. I probably should be giving them more than that. You are overdosing that and giving, say, 0.3 rather than 0.03. That, like 10 times overdose in a smaller animal can cause problems. The other one is mixing well. You would be amazed at the amount of people that bring in bottles to us and like, I've run out of medications, and you refill, and all they've done is just drained all the liquid, and all the medication is just sat in bottle. We make up a lot of our liquid medications ourselves, or they enable us to dose smaller animals, so they're just crushed pills in a suspension. So if you're not mixing them up before every single time that you're giving it, then you're underdosing the medication. And the other one is refrigeration. We get calls all the time from people saying, I just noticed that my medication needs to be in the fridge after giving it for like 4 or 5 days. Most of them have a decent temperature range, so it's not the end of the world, but it should be very clearly marked that they do need to be refrigerated. None of that is an issue with pills. I mean, the biggest things, as you're probably already aware, is trying to give them in some kind of food. You get pill pockets, deli meat, peanut butter, anything that's going to entice them to take that medication. Really still can't do that. Then you can always turn them into liquid medications. So you crush them up like in a bag with the back of a spoon or something like that. You can get a syringe from the clinic. We get big syringes that even if there's a decent number of meds, you can draw them up with water, just mix them up and then squirt that solution into their mouth. There are animals that are that difficult to give medications to. So how to restrain? Restraining from behind. Because what they're going to want to do is back away from you. You want to stand with their abdomen, with their ribs kind of here, in between your legs. If you can kind of brace them, then you're sitting in between the hips and the ribs. And it means as you're trying to give meds and dealing with their head, they can't really go forwards because then their hips bang against your legs and they can't go backwards. When you restrain, there's somebody behind the dog holding them from behind. You have much more control over the head, which obviously is if you are dealing with a difficult animal and they are like getting a little rowdy, it's much easier to control the head if you're behind them than if you're in front of them. And you can basically do everything you need to do from the back with a lot less risk, and that means they're much less able to maneuver kind of away from what it is that you want to do. If they're being super wriggly, the best bet is to try and get them to sit down, and then you can actually sit behind them. Because then you have real good control over the head. There's not really much they can do, and they can't and they can't back away, because anywhere they're going to go backwards is going to go into you, and forwards you have an arm around them. So it makes a huge difference with any medications.
If you get your fingers behind their canines, you can kind of just get back here and just shove it in the back of the throat and close the mouth and just massage. You can blow in their nose, that'll stimulate them to swallow. But yeah, mainly just closing the mouth immediately and holding their head up, because some of them will hide it in this pocket and shake their head, and then the pill goes flying.
There's a spot behind the teeth before the jaw ends. Usually more than enough space to fit a finger in there. It's a super good spot for the liquid meds, and if they're being really difficult and they're just wriggling all over the place, you can always sneak pills in through that hole. And then once it's in the back, because that's like right by the back of their throat, if you then just hold their mouth shut from behind, massage their throat, etc., then eventually they'll just get bored and swallow the pill. So that's obviously for big dogs. For small dogs, towels really are your best friend. Basically, you fold the towel into a square, put the animal diagonally across the towel, you fold the front of the towel across their legs, and then basically burrito them up. And that closes in their front legs and then their whole body. And then at that point, you can actually basically straddle them, because they're all wrapped up in the towel in a nice burrito, and then do exactly what we were doing with the big dogs. So this is like an overview. I mean, if you've fostered any medical cases, I'm sure you've seen a decent number of these already. Diarrhea is a weird one because there are tons of different things that cause diarrhea, and because we don't have the capacity to do a lot of diagnostics in the clinic, the way that we approach it is by ruling things out, by treating. That's rather than, well, we did this and it's still painful, so we'll add in this. It's more, well, we've ruled out this and it hasn't stopped, so now we're going to try and rule out this next thing and it hasn't stopped. So that's the way it works. So you'll see dewormers first, which is Panicule marquis, which treat like roundworms, hookworms, etc. Marquis, which treats coccidia, which is a parasite, like a single-celled parasite, and Praziquantel, which treats tapeworms. So even if you're not seeing worms, you're just seeing diarrhea, the most common cause of diarrhea is some kind of parasite. Before doing any meds, just as a point of reference, this one and this one are hands down, they're like 75–80% of all of the things we get inquiries about are URIs and diarrhea, and they mostly resolve on their own within 48 hours. With 3 fingers, you would just go,
Oh, big needle.
That's a good boy. And then your best bet is to just put your finger on the fluid line. So then the needle is in, and then the fluid line isn't going anywhere. And then you roll this up to start. And then you can see the fluid in.
Oh, weird. They usually react right when the fluid's going in because it's cold, it's weird, and then they usually kind of settle down because they realize it's really not painful, it's just surprising.
And to take it out, I would just pinch around the needle and then take it out. And then you can just pinch afterwards. Oftentimes, if it's like a really big pocket, it'll leak out. IV meds, mostly we'd be doing them if they were hospitalized, so they were on a pump or something like that. So all the clinic staff is doing it. The one exception though is treating the stem. You can just give supportive care, while the body beats the virus. So one of the ways that we try and help the body doing that is giving like really high dose intravenous vitamin C. It causes them to flood their body with interferons to beat the virus before it does damage. We're never going to send you away with an animal that needs IV meds without a catheter. And a catheter is like in the vein with a T-port coming out of it that you can attach syringes to, and then you just push it and it goes straight into the vein. So there's no like minimal skill involved in doing it. A lot of it is just confidence. Same as with SQ stuff. It's just having the confidence that you can do it, and it's fairly straightforward.
So we'll give you syringes of the actual IV vitamin C, which are the giant ones, and we'll also give you syringes of just flush the catheter. So before, every time you do it, you want to flush because there's going to be blood like this in the line sometimes, and you want to just make sure the catheter is actually working properly. All of them are going to have these T-ports with a clamp and a cap on them, so you'll actually administer the meds in this part right here, and the blue cap just screws off. Try to keep everything as sterile as you can, so I always put it on the side that's not going to be touching the T-port again. Every time you get the syringe, I always make sure there's not like a giant air bubble at the top and just squeeze some out. And the syringes will also just screw onto the catheter. Once it's screwed on, you can unclamp it. If you unclamp it first and they have really great blood pressure, it's all going to come out. So then you just unclamp it and just flush through. You can even, if you could put your fingers near their elbow and like pulse the syringe, you can feel it, and that's how you know the catheter is working and it's good. If you see that you're injecting, if it's not flowing, it might be clogged. If you're injecting the flush and you're getting like a huge bubble here, then the catheter's blown, so don't proceed with any treatments, and then we'll have to replace the catheter. And then just make sure to clamp it before you remove the flush. The vitamin C is the same thing, screw it on, and then unclamp. With the vitamin C, you want to inject it pretty slowly. Usually you'll have to do it fairly slow anyways because it's a bigger syringe and it's a really small catheter usually in little puppies. So it's not easy to push it quickly, but it's better to go slow because they can react to the vitamin C. It can kind of sting. I think it can kind of cause a weird taste in their mouth. And if it's given too quickly, sometimes it'll cause them to vomit. So usually when you're giving it, even if it's slow, you'll notice them like start to lick their lips a little bit or drool, which is normal. And then once you're done giving the vitamin C, you'll just re-clamp it. And then you want to flush the catheter at the end as well, because the flush that we give you also has like heparin in it, so it keeps the catheter from becoming clogged until the next time you use it. And then always replace the blue cap also, so no contaminants or anything can get into his line, into his vein. So just e-collar for the entire time that they're having a catheter, which is usually only a couple of days.